It happens. Awesome. Okay, so what I'm going to do is we're just past 9 o'clock, so I will call this meeting of the Commission on Aging to order. Our first issue is our discussion of the November minutes. Does anybody have any questions or changes on those? Hearing none, can I have a motion to approve the November minutes? Thank you, Peter. Thank you, Mary. All in favor?
Aye.
I'm counting all on everybody. Great. I'm not seeing Beth here yet, and if Beth, am I missing you, let me know. Not hearing Beth. So I'll skip over to Allie. Allie, if you can start with our Human Services report, and then we'll come back to Beth if she makes it.
Sure. Good morning. And just so you know, I believe Beth has her holiday luncheon today, so she might just be running a couple minutes late. I think they have like 100 people, I believe, coming. So, yeah, the drive-through. Anyway, so our holiday program is well underway. We, because of COVID restrictions, as I think I said last month, we're strictly doing gift cards for our families and our seniors, but it's working out great. And we have 54 seniors that have been adopted. And we're really grateful because Megan Dunn, who's a social work student, and Karen Dunn from the Selectman's office daughter, is going to be volunteering for us next week and delivering them to all the seniors so that we don't have to have them come, even though we've been having people stay outside in their car, save them a trip. So that'll be great. So many organizations, schools, individual people have been donating to us. It's just off the charts amazing. We're so fortunate. Actually, the Old Timers Athletic Association once again donated to us this week, and they gave us $1,000, and they want it designated just towards helping seniors, which of course we'll do. So we're grateful to them as well. Medicare open enrollment is done on December 7th. It was very challenging this year because we're not doing in-person meetings with the seniors. So it's always time consuming, but now it was kind of double the time because we're trying to do things remotely, but it was successful and we helped all those who wanted the help. So that was the goal. Let's see what else. Oh, a new initiative, thanks to Jamie's idea. It's Darien Human Services, along with the Community Fund of Darien, will be mailing out a postcard on mental health resources. Oh, there's Beth. To every resident in Darien. So every household will be receiving one in the next couple of weeks, hopefully, telling, as you all know, mental health issues, particularly around the holidays, they always escalate and people struggle, but this year more than ever because of COVID. So we just want to make sure that everyone knows that we can be the kind of not gatekeeper, but like the liaison, helping people to find out what resources are available to them. And we're here in Human Services, we're support as well. So that is great. We're going to be sending, you should be getting that in your mailboxes, hopefully before the new year. What else? Oh, Operation Fuel, they started their winter season. Just so you guys remember, once a year, our clients are able to get up to $700 to help them with a fuel delivery or with their utility bills. It used to be $500, but since the pandemic began, they increased the limit to $700. Oops, sorry, hold on, let me turn that off. And normally they've been giving us $6,000. They have 2 seasons a year. This year they gave us $15,000, which we had to do a double take in our office. We thought, oh my gosh, numbers are usually decreasing, not increasing. So that's huge. And we are going to put something probably in January out to the papers and the social media so that people know that this is available, because it's particularly helpful for our seniors, those that might have some savings. There's no asset limit. And the income limit is slightly above what it is for energy assistance. It's $45,000 and change compared to $37,000 and change. So even if it's one oil delivery, that can make a big difference. So we were thrilled to hear that. As I just mentioned, energy, that continues, ongoing until March for oil delivered homes and until May with utility heated homes. The utility companies have been very helpful and cooperative with residents. They're working on payment plans. There's no shutoffs. They're making things much simpler for our clients to get the resources that they need. And I'm going to say this, I think every single month for now, the Darien Human Services has an emergency call list, and we are really wanting people to sign up for it more than ever. We have over 100 people on it now. And yesterday, because of the pending storm, 4 of us in our department divvied it up and we called residents, and we will be bringing it home with us tonight, just in case. And we will keep in touch with them throughout any storm or townwide emergency. So we really keep trying to put a plug out there so that people know about this. So we can't help people unless we know that they're out there and they want this service. So that's about it.
Okay. Thank you, Allie. One quick question. What is the deadline? I know we're already on the 16th for people to contribute to that gift fund.
So people who have, we started it a little earlier this year because we wanted to make sure to get, particularly for our families, to make sure that the parents could get their gift cards and shop as necessary. So we are not doing any more adoptions, but we take and we appreciate gift cards throughout the year. So as people are calling now, we're saying if you can give food, gas, Walmart, Target, those can help people with essentials throughout the year. So there's no time limit.
Fantastic. That's great to hear. Thank you. Any other questions for Allie? Hearing none, I'll move back to Beth. Beth, welcome, and we'll take your Mather Center report.
Sorry to be late, but it's like a typical Circle of Light day, only we have 100 folks coming outside to pick up the lunch. And we have 35 people. It's a record for us, going to be participating virtually at 10:30 in a program that I'm actually doing with a musician and me. So it should be exciting. We spent this month really doing as much as we could to try to keep people's spirits up. The robocall that I've been doing weekly is getting really a good solid response. Many people that just have telephones are calling to have conversations with us, so we're being able to identify a little bit more. And on Allie, we'll probably be giving you more people's names too, based on that the calls that we're getting. The folks that are non-residents that I feel are in some difficulty, family and children's, which if Allie already said this, Allie, I'm sorry, they have actually gotten money for counselors just for COVID related stress. So any age, it could be family for young people, but seniors also qualify. So I've been referring them there too and that's free counseling. It's a subsidized counseling. They got a big grant for it, and there's many people participating. The social worker there that's leading that is Sheila Hughes, and she's really quite good. We did some intergenerational stuff. We did wreathing with the Darien Youth Commission, where we did a drawing and had over 35 wreaths given with beautiful note cards from middle school kids. We also just did another program with the Y, that the preschool did their cards. We had to put stickers on them so they knew that they were from the preschoolers, but they were very, very sweet. And Darien High School, the core group yesterday just dropped off really beautifully handmade cards with quotes in them that we'll be passing out too with the lunches. Our average lunch has increased to about 42 people a day average. We're feeling for the chef, and because we're down a building attendant, that we're going to make a regular cutoff of 50. Darien residents are priority. So with whatever program we do, whatever limit, if there's a limit of attendance, it's Darien residents first. We have now gotten a Zoom license. One of the reasons why we wanted one was because all of the senior centers we're collaborating with are on Zoom. So it's easier for us to just actually help folks with one platform. It can be quite complicated if we go into two, even though they're really not that dissimilar. So we're facilitating more programs ourselves. I'm doing a weekly now, brain teasers and twisters on Friday, which we started off with 3 people. I think now we're up to 15 joining in on that. So we're trying, and I'm doing once a month a laugh out loud, which is just a joke telling thing, which is actually quite funny because people bring their jokes too. Most of the time they're very appropriate, sometimes not so much, but as long as everybody laughs, that's the main part of this. So we are now virtually connected. We're very capable of all that we need to do. We are planning for the spring more outside events. Our understanding is the full vaccine push, even for folks that are a little older, may not be really to the point that we can open up easily, maybe incrementally. We're going to start looking at doing that again, probably in the spring. But full bore opening is still going to be a little while off as we all get vaccinated and get safe and ready. We are identifying now instructors, especially the most popular exercise instructors who are willing to come in. And now that we have the capability, we're going to live stream some of the favorite exercise. Carla will be very happy. This is
really happy.
So yeah, Lisa and Linda are both on board. So we'll be doing that probably maybe toward the end of January. We're still working the kinks out of that. So, you know, we're becoming specialists in things that we never thought we would be doing. But at the same time, we're planning for when we can incrementally open. You know, the meal thing is huge. I wish that some of you could be in line. The social interaction, even for a few minutes. I mean, today, this is what we will look like when we're out there. You know, we're giving everybody a bell to ring in the new year. We're willing to do as much as we, you know, we got some music in the background that we'll be dancing to, and we're going to do something different every day next week as well. You can't believe people actually come to tears. The sillier we are, and I know they're tears of joy. So you can't underestimate even things that are getting 25 people, 35 people. They're all different people. And again, the people that we're probably most concerned for, we're sending over to Allie, that they need a little bit more of an intervention for sure. We're not doing that, but we're just trying to keep the spirits up and showing people how powerful they are if they connect with each other, to encourage all that goodwill between them. And I know a lot of you are doing really good things, staying connected with folks as well. So it's just it's a whole new game, folks. And I feel a little old for this, but I'm going to be setting up the Zoom meeting soon myself too. You know, we're all going to get proficient. I have to tell you, many of the people that were most resistant, and it's usually the 85 and up folks, when they do come on, when they have the technology and they do come out, they feel so good that we, even in these little Brady Bunch squares, we're all seeing each other. So it is really providing a connection. So part of it is the encouragement. I think one of the first things that we would do, even when we can incrementally open, is have teachers in our computer room to teach people so they don't feel so apprehensive, you know, and say that this is the world you have to be in now. If we didn't have the virtual, where would we be? Oh, and we're working on we're doing boomers to Zoomers. That's what we call our training. You know, we had to come up with a little sticky name. And the next thing we're doing for the people that I just found out that my senior center can do this, we're making a party line for 4 to 5 people that have no technology except for the phone. And I'm coming up with activities for that too. They won't be long calls, maybe 20, 25 minutes, but we're going to kind of cohort people that just aren't not ever going to go on technology, but let them have something to look forward to too. So that's what we're doing.
I have a question. I have a question for Beth. Beth, our robocall comes in at 6:05 on Friday evening, which is perfect for us. Does the robocall come in to everyone's home at the same time?
You have a span of time that you're allowed. So my senior center gives me, I do it from 6 to 7 o'clock. So for instance, for Darien residents, I think it's 935 calls. So they have from 6 to 7 o'clock to complete all those calls. And for our non-residents, same thing, different time that I have. Just so they give us if you do it within an hour. And that's why I'm trying to keep the calls brief. I think the one I'm doing this Friday is funny, I hope. So I'm trying to, you know, so many people call and say to me on Monday, I got 16 emails this Monday thanking me for calling them personally. So many people think it's, you know, a personal call. So I somehow or other it's doing the trick. And Peter, I have to really shout out to Peter. Peter has been my editor, my auditory editor. He's given me advice on going slower, not taking 2 deep breaths, to get to waiting a little bit. And I've been streamlining all of the calls so that they're not too long, but so that they know that it's a, a happiness thing. It's not an alert. It's never an alert. So
it's great, and it really comes true. Also, to attest to what you're doing with the drive-throughs, Kathy and I have gone a few times just to see what's going on and to get a good meal, and it is just as effective as you say it is. And again, if there's any other seniors on the senior commission, aging, I would encourage you to do that as well, just to experience it, and then so that when you talk about it, you can talk about it in reality. Super job, Beth. Thank you.
Thank you, Peter. Thank you. Yeah, Judy's out doing herself too. She's doing full dinners and exquisite meals. So
Awesome.
Thank you.
Great, thank you. Any other questions for Beth? Hearing none, thank you, Beth. And moving on to Jamie. Jamie is going to give us a report on the COVID-19 in Darien and the response there too. Thank you, Jamie.
Thank you. Good morning, everybody. I'm just so inspired by what I hear from Beth and Allie and everybody on this call. We all worry so much about the physical health and mental well-being of everyone in town, but particularly our seniors and our young people. So kudos to you for innovating. That's really been the theme through the pandemic here in Town Hall, is how can we innovate to continue to provide services that our residents need. And I like to think about silver linings. If you didn't listen to my State of the Town speech, I recommend it because with every challenge comes great opportunity and lessons learned. And I think one of the things that we've learned here is that some of these innovations are going to stick. People really like them. Moving services online, being able to connect with people virtually so that you don't have to worry about, oh, I'm scheduled to be somewhere next Tuesday, but I really need to talk to somebody today. So I love the things that we're doing. Thank you so much. You all get gold stars for going above and beyond through this entire pandemic. And what I hope for all of you is that you're able to get some rest and have a peaceful holiday season. It certainly has been difficult for everyone with the COVID-19 pandemic in Darien. I will say that I think that we actually have fared well considering our population size. As of yesterday, we've had a total since March of 544 cases of the coronavirus that have been documented. I feel fairly certain that we've had a lot more cases than that, that just no one ever got tested. Maybe they had the sniffles, a little bit of a headache or something of the sort, or maybe even no symptoms that never got documented. Interestingly, of those 544 cases, they came from 394 households. So that close contact really is the way that the virus is spreading. So for those who've been diligent, and I know most people have been protecting themselves, staying home, or if they have to go out, they stay well separated and distanced from other people. That really is the way to protect yourself, and to always wear a face covering for sure. A bit of good news, I think, for the elderly in our community. If you look at the time period from March to the end of June, we had 34 cases of coronavirus in the population ages 70 and over. From July 1st to today, we've had 17 cases in the elderly category. So the strategies that people are using to protect themselves are working. Clearly a shift toward the younger populations. We see a lot of parents with the virus and kids with the virus now in the same household. So I think that's very good news. And I think we're going to have, we need to continue to do what we're doing, certainly through the winter. Winter is going to be a tough time for everybody, but the vaccines are rolling out. They're here in Connecticut. Frontline healthcare workers are being vaccinated. We received a little over 31,000 doses in the initial shipment from Pfizer. that will only vaccinate 15,000 people, but helping our frontline healthcare workers in hospital settings is critical. The next group of people that will be vaccinated, I believe, are folks in our long-term care and nursing home facilities, which is wonderful news because, if you've looked at the data, 70% of the people that have passed away with COVID complications are in our nursing homes and assisted living communities. So the sooner those folks can be vaccinated, the better. And then hopefully in the spring, and this is all subject to the rollout of, who's ever producing the vaccinations. Pfizer first, Moderna was, I believe, approved yesterday, and perhaps others. The elderly population not in nursing homes hopefully should see vaccines by the springtime. And then the rest of the population, hopefully by midsummer 2021, will have access to vaccines. Vaccines are not mandatory at this point in time, so it does remain to be seen who will take advantage of getting a vaccine. There's been a lot of PR about the vaccines and how safe they are, so I'm hoping that, I admire the first wave of healthcare workers that are taking the vaccines, and that's going to go a long way to give people confidence that they too should be vaccinated. So, I think we're starting to see some really good news on the horizon. I would be remiss in not telling everybody to make sure that you're prepared for the snow tonight. I know that Allie's been hard at work calling all of her clients. It's going to be a big one, and we haven't had a big one for a while. Last year, I love the snow. Last year we didn't have very much at all, but you should expect that between snow's going to start sometime around 4 to 7 p.m. tonight, get very heavy in the overnight, and then taper off by early afternoon tomorrow, and we could see a foot of snow. So hopefully everybody's prepared. You have your medications and food and the like. We could see some power outages. We're supposed to have gusting winds of up to about 40 miles an hour. I'm going to hope and pray that we don't lose power, because it's going to get real cold by Thursday night. Wind chills into the teens on Thursday night. But our DPW knows how to do snow, so give them a couple of days and they'll have the streets all cleaned up. But tomorrow's going to be messy and dangerous, so please don't be out if you don't need to be out, and spread that message to everyone that you know that is elderly or vulnerable. Let DPW go out and do their work, plow the roads, clear the sidewalks, and then we can all get back to business by the end of the week and the weekend with whatever our final holiday preparations might need to be. With that, I would love to answer any questions you might have.
Jamie, I'd like to come back to the vaccine for a minute and talk about it. On Monday, I called our primary care provider who's here in Darien and who's connected to Stanford Hospital. I spoke to the gal that runs the office, know her very well. I said, okay, put me on the list. And she said, what are you talking about? I said, put me on the list for the vaccine. She said, well, we don't have that yet. I said, well, when will you have it? She said, well, I don't know. She said, we haven't heard anything from Stanford Hospital yet. I said, okay, when should I call you back? She said, I don't know. I said, a week? She said, I don't know. I said, a month? She said, no. She said, I really don't know. And I said, okay. I said, just know that there are going to be people with their hands raised and they're going to be curious. That led me to this. I said, gosh, there are probably a lot more people like me that are interested in it. So I called David Knuth. Am I pronouncing his last name right?
Knopf.
Knopf. So I called him and I had a great conversation with him, and essentially had the same conversation with him. And he said, I don't know, but he said, but he said, we have a vaccine committee. And I said, tell me about it. And he did. And it's wonderful. You're on it, I know, so you know all about it. And others are on it. But again, I think this is the kind of information that we're going to have to populate and get out there for two reasons, okay? for those of us that are going to walk around town with our hands in the air saying, hey, vaccinate me, but there's also those that are going to be sitting on their hand. And those who are going to be, and we may not be able to say, you will get the vaccine. I remember that when I got the polio vaccine as a kid. I mean, we didn't have a choice, we got it. But now you have a choice. But we know it's just as important. So what are we going to do? So what I'm saying is, while the horizon is maybe a couple of months till it gets to people over 70, a couple more months to jump on, that tension and information chain is building. It needs to be worked on. It needs to be promulgated. Let's take advantage of it. Let's talk about the vaccine committee and let the town know that, hey, like everything else in this town, we've got a plan for it. We're geared up for it, and we're ready to hit the ground.
Thank you very much, Peter. We did announce in our Board of Selectmen meeting that we have a vaccine committee. You should see the stories about it. The Darien Times has written a story about it. The health department has convened this committee that will include, obviously, staff from the health department, all of our medical advisors to the schools and to the town, members of the advisory board of health. And that is the objective of the vaccine committee, is to do just that, to push information out to the public, which we will do in a variety of different forms. So we're working on setting up our first meeting. I'm not surprised that you got the answer you got from your primary care physician. I believe the vaccine rollout will be exactly the same as the testing procedures have been through the pandemic. Tightly controlled by the state of Connecticut initially because of the scarce resources, given to hospitals and healthcare systems, and predominantly those healthcare systems that are in areas of folks who are underserved communities will get vaccines before the town of Darien residents will get vaccines, unless your primary care physician ultimately gets access to those. It's not, for the Pfizer vaccine, not everybody can really handle the product itself. It requires, this crazy deep refrigeration. Our in-town testing provider, Everpoint Health, is working very diligently to try and become a provider of vaccines. We are hoping that we'll be able to transition ultimately, not tomorrow, probably not in January, but maybe by the spring, to being a testing provider, to becoming a vaccine provider. And he's willing to, Dr. Caleb Moore, who is the founder of Everpoint Health, some of you might know him, is committed to investing in whatever he needs to be able to provide those vaccines. So I think it's going to be closely held by the hospital systems initially and distributed as the advisory committee to the governor. He also has a vaccine committee, Peter, and it's a pretty lengthy list of people that are on that vaccine committee. And they're determining the distribution right now. But I think it will, as more vaccines and more providers can manufacture, it'll become more available to our, hopefully, what we're thinking is that maybe our CVS, our Greaves, our Walgreens will be able to provide vaccines. We've actually made sure that from a zoning permit perspective, those pharmacies have the approval they need to be able to do testing and vaccines. Some were prohibited from doing so, but we made that change about a week ago. It's going to take some time, and you're exactly right. Information is going to be critical. It's building, and we will make sure that the vaccine committee is front and center, providing that information to the public. And thank you for whatever suggestions you have. Keep them coming to the health department so that we can, capture your ideas. Very important.
Thank you, Jamie. Other questions for Jamie?
Yes, Jamie, the testing, is this free to our residents?
The testing is not free to our residents here in Darien. There are places that you can go, and if you visit the town website, you can find at the 211 website, actually, 211ct.org, I believe, you can find a list of all of the testing providers statewide. There are certain testing providers that there's no out-of-pocket cost for you. They're government subsidized. The community health center locations come to mind. There's community health center testing locations in Stamford and Norwalk. I think the closest one is at the Terry Connors ice rink. Some of the challenges with that, and certainly easy to overcome, those testing sites don't allow you or require you, maybe is a better word to use, to schedule in advance. So you go stand in line, and the lines can be pretty long, but you don't have any out-of-pocket costs because the government is subsidizing. Darien is not eligible for a subsidized testing site. You know, we're considered a high opportunity community, so it's just not available to us. So we have had, as you know, a testing provider in town since the beginning of the pandemic. Our initial provider took insurance, and so there was no out-of-pocket cost to you. But there's been some challenges with that testing provider who was billing insurance for questionable amounts of money. I'm not going to opine one way or another on that because there's a lot of mixed information about that. Anyway, we switched providers to EverPoint Health. EverPoint allows you to schedule your test, and you can get one of two tests through EverPoint: a rapid test, or what they call a rapid test is an antigen test, which is a test that's very effective if you're having symptoms. And then you can find out same day if you have COVID or not. The gold standard of testing for anybody that just is curious, you've had an exposure, no symptoms, is called PCR test. You can get that too from EverPoint. Both of those tests cost you $200 out of pocket. You will get a receipt so that you can then submit it to your own insurance. That's how it works for us, and that's the provider that we've been able to have here in town.
Thank you.
You're welcome.
Other questions for Jamie? Hearing none. Thank you so much, Jamie. Very informative as always. Really appreciate it. And thanks so much for all you're doing, especially the wonderful phone calls we get. We immediately put them on speakerphone so everybody can listen when they come in, and so we can make sure that we're doing what we can. And I think that everybody's doing their best to try to stay safe for the next several months, if not longer. And we appreciate all you're doing for that. Thank you.
It's my pleasure. Thank you for having me today. I wish everyone a very happy holiday. I'm going to hop off to grab another meeting, but it's very nice to see you. Stay well, everyone.
Thank you.
Thank you.
So moving on to old business. Does anybody have any old business? Peter, I bet you've got some old business. Whoops, except you're muted.
I have quite a bit of it, and some of it isn't that old. Yesterday, 35 of us, 35 AARP volunteers on legislative issues, had our annual meeting. Usually it's in a restaurant in New Britain, and of course this year it was virtual. And we had two speakers. We had Kevin Kelly, who's a Republican Senate leader, and he's from Monroe and Shelton. And we had Matt Ritter, who's a Democratic House Majority Leader from Hartford. And so we spoke to them, and we told them what our agenda was, what our issues are in the coming legislature, and they responded. Let me take a little bit of time to go through what AARP sees as critical issues. Number one, certainly, is residential care facilities. We've heard recently that some facilities are forcing residents to remove their Siris, their little speakers, are taking away their phones or their iPads. And so we're pushing to make sure that, like anyone living in any home, they have the same communication devices in their home. That's number one. We also know that because of COVID and what's happened, more and more people are wanting to be cared for in home. And so again, the legislature needs to start to refocus on what we need to support in-home care. And this year it's going to be critical because this year is a budget year. Okay, we don't have a budget year in Connecticut every year. We didn't this past year, but 2021 we do. So they're going to be looking for money. And so what we're saying is don't look for money where it's going to hurt seniors, because we know what's happened before. Following on that conversation, we talked about prescription drugs. We've heard from a number of people that some of the providers are starting to redefine insulin coverage to try to take away some of the discounts that have been given. And again, the majority leader did not know that. And so again, we're saying, you know what? You got to watch the insurance carriers that don't gnaw away at benefits. Social Security, as you know, we've had a rule on the books that they're not going to income taxes, and they took it away. They gave it back. And what we're saying is, if you're looking for budget money, don't think about reinstituting a freeze on that Social Security income tax. So these are the kinds of things that are going on. Prescription drugs, voting. We had a very, very successful year voting, but guess what? Absentee ballot, mail-in ballot voting, it requires a constitutional amendment. It will take either 2022, 2023, or 2024 for the Constitution to be changed to bring us in line with lots of other states where we can have no excuse absentee ballots and we can have mail-in ballots. I mean, this year we did it because, again, of the COVID and pandemic, it worked very well. And again, both of the leaders, Republicans, Democrats, recognize it, and both say now, okay, we see that this is something that we need to pay some attention to. The sessions in Hartford next year will be virtual. So again, we won't be able to go up to the Capitol. However, testimony will be open to public on all committees through interactive media. So you'll be able to testify. You'll be able to get it. There'll be a lottery number for some committees that have large constituents. I asked both legislators, I said, how do we bridge the divide that we have? How do you bridge the divide that you've created? How do we bridge the divide? And they said a couple of things. Number one, what they said was, we listen to the people when they email us, when you call us, when you appear at a webinar or a Zoom meeting, and you put your comments in. And it was interesting because Matt Ritter said, I listened just as much to the people that voted against me as I did that voted for me. And he said, if you don't think it's a certainty, make your voice heard. Take the time to attend these sessions, make your voice heard. Quick example, tomorrow night, I think a webinar that will bring together Senators Duff and Leone and Representative Blumenthal, 3 of our 4 legislators. It's a public webinar. I'd encourage you to go on it. You have an opportunity to interact by asking questions online. Again, so we need to pay attention. We need to pay attention to these issues. And so it's going to be another critical year, complicated by the fact that they're going to be looking for money. Again, hopefully, the federal government will pay attention to us and give us some grant, but within the state, we're going to be looking for money. Second thing, I just completed a 6-week program with Quinnipiac College, a senior center at Hebron, and AARP. They're putting together a zero isolation program, which is intended to really begin to, I see Beth nodding her head, which really begins to bring together a program to address those in zero isolation. I've got to say it's very effective, but it is going to be a major effort. It's going to rely on senior centers. It's going to rely on aging in place organizations. It's going to rely on active human resources executives in our towns, but it can really, really work. I was quite impressed with the program. So I'd say watch for that, and there'll be more about that. Turning now more to the local level, a couple of things. I did my first session on the blight committee or commission. Jim, you've left huge shoes there. I'll tell you, I'm not stepping into those shoes, but it's worthwhile, and it's certainly interesting, and I think it's helpful to the town. So I appreciate that connection. I'll try to do my share of that. Time capsule is still open, and anyone, Joe, you especially, you better have your letter in that time capsule. Because it's going to be open in 2070, and your children or your grandchildren will probably be able to read what you wrote. You may even be there, Joe. I don't know. I won't be there. But at any rate, and one of the things we did was we reached out to the 3 senior care facilities in town. And that too was an interesting experience because one of them, the social director, one of them is a town resident. So, hey, you don't have to tell her anything. The other 2 are strangers to town, new to the job. Talk to them and they say, wow, what a great idea. So again, it's getting the word out and staying connected. Darien Library, lots of virtual events, lots of webinars and lots of Zooms. And again, encourage you just to visit their site. Elizabeth Maricola pointed out that next month, and I'll mention it next month because it's at the end of next month on January 26th, they're going to have a very significant speaker, Dr. Simran Singh, who is an American scholar, writer, and educator, and he's going to talk about representation mattering, what being seen means to the marginalized, what being seen means to those people that are maybe in their homes and isolated and out of the mainstream. So again, great programming, and I'm sure Gina is going to go on, but all of that is captured, of course, in the monthly bulletins from at home in Darien. Last night I learned that Handel's Messiah is not a Christmas piece of music that Handel wrote. It's for Easter, and what they did was they marketed at Christmas because they needed to sell tickets. So lots of interesting little bits of curiosity there. I think that'll do it for me, Joe. One other thing, a shout out to Channel 79. If you look, Channel 79 has expanded its programming and putting in on its programs events that happen in town, not necessarily governmental events, but events in town. And again, give that extra exposure and publicity. So again, I would encourage folks to watch with Channel 79 and then either look at it live or look at it later on Vimeo.
Sounds great. I'm giving everybody a fair warning that we might be cut off, okay, because Kate Bush had another video meeting at 9:45. So if we are cut off, that is the reason. I'm not turning you off, but as we hit 9:44, I wanted you to be aware of that. And so, Gina, can you give us a quick rundown on what's going on at Home in Darien?
Yes, happy to. Can you all hear me?
Yep.
Okay, so we had our annual meeting last week, and Marie Allen, the executive director of the Southwestern Connecticut Agency on Aging, was our guest speaker. It was a fantastic presentation on attitudes, anxiety, and ageism in the time of COVID-19. That will be shown on TV 79. It will also be on our website shortly. And so I encourage all of the commission members, but the town in general, to take a look at this really important presentation. It's a great topic and something that we need to bring more attention to, ageism. Additionally, we at Home in Darien collaborated with the Darien United Methodist Church to give 55 gift bags to the new residents at the Royal. So we delivered those welcome bags a couple of weeks ago, and they included information about all the services for seniors in Darien. And then we are also delivering holiday gift bags this week to about 30 Darien seniors living alone at home. So that was in collaboration with the Ox Ridge Girl Scouts, just to bring some holiday cheer to those people at home. I tried to be quick.
You made it. Well done. Other old business? Any new business? Hearing none, we did it, folks. Well done. I will look forward to seeing you in January. Can I get a motion to adjourn?
I'll give a motion, Joe. It's Jennifer.
Thanks, Jennifer. Appreciate it. Got a second? Thank you, Peter. Thank you, Jim. All in favor?
Aye.
Appreciate it. Everybody have a wonderful holiday season, and I look forward to seeing you in January.
As do we, Joe. Bye.
Happy holidays. Stay safe.
Take care, everybody.
Bye-bye.